Hello everyone, and welcome to Restorative Health Solutions. If you understand what's making you sick, then you can start to understand how to get better. More information is power.
Hi, I'm Dr. Paul, and today we're going to talk about SIBO versus IBS. The first question to ask is, what is SIBO and what is IBS? SIBO stands for small intestinal bacterial overgrowth and is a condition that occurs when bacteria that are supposed to stay in the large intestine or colon begin to travel up into the small intestine. This bacteria then begins to feed on food in our small intestine, creating a fermentation process that can lead to significant symptoms. IBS stands for irritable bowel syndrome. It is a condition that is considered to be a functional bowel disorder according to traditional medicine. This simply means that there is abnormal functioning of the GI tract, but all the normal GI tests are typically normal, like CT scans, ultrasounds, colonoscopies, endoscopies, blood tests, etc. In other words, your bowels are irritated, but we don't know why. The next thing to discuss is, what are the symptoms of SIBO and IBS? Here are the most common symptoms associated with SIBO. Gas and bloating, especially after eating. Constipation or diarrhea. Acid reflux, heartburn, GERD, nausea, abdominal pain and or cramping, food sensitivities, irritable bowel syndrome or IBS, and more. And the most common symptoms associated with IBS are abdominal pain, gas or bloating, constipation, referred to as IBS-C, diarrhea, referred to IBS-D, and you can also have IBS-A, which is irritable bowel syndrome alternating, or IBS-M, which is irritable bowel syndrome mixed, referring to constipation diarrhea that may be mixed or alternating. And now to the most important question. What causes SIBO and IBS? Here are some of the common causes for SIBO. Low stomach acid, medications such as antibiotics, alcohol consumption, chronic stress, processed inflammatory diet, a past history of GI surgery, suppressed immune system. And we can also have additional factors that may be present along with SIBO that can contribute to very similar symptoms, such as food sensitivities, lack of beneficial bacteria in the gut, yeast and candida overgrowth, parasite overgrowth, low stomach acid like mentioned above, low digestive enzyme output, poor gallbladder function, etc. As for causes of IBS, IBS is considered to be idiopathic according to traditional medicine, which means that we really don't know the true cause. In functional medicine, we believe that it can be a combination of several different factors that can contribute to IBS depending on the individual patient. We find that food allergies, food sensitivities, imbalance or dysbiosis of the microbiome from bacterial overgrowth, yeast or candida or fungal overgrowth, parasite overgrowth, lack of beneficial bacteria, chronic infections, toxicity can be a trigger, stress, dysfunctional brain-gut axis, along with other factors can potentially contribute to IBS. The next question is, how are SIBO and IBS identified? How are they diagnosed? What testing is used? The gold standard test for diagnosing SIBO is called the aspirate and culture test. This is where a sample of fluid is taken directly from the small intestine, usually in the jejunum, via endoscopy and cultured to quantify bacterial growth. It is considered gold standard because it provides a direct measurement of bacterial load in the small intestine. However, this test is invasive, expensive, and not widely available, so it's rarely used in clinical practice. The most common test used today to diagnose SIBO is the SIBO breath test. And this is where we measure hydrogen, methane, and sometimes hydrogen sulfide gases from the breath at different time intervals after drinking a sugar solution. However, this test is only considered to be moderately accurate and reliable. So what tests are used to diagnose IBS? Well, there is no current test used for IBS. In terms of IBS testing, this is referred to a diagnosis of exclusion. So what does that mean? That means that you go in with IBS-like symptoms, whether it's abdominal pain, gas and bloating, constipation, diarrhea, and you've done all the tests, right? You did the CT scan, the MRI, or the endoscopy, the colonoscopy, the ultrasound, maybe a stool test, blood test. Everything comes back negative, but you still have these symptoms. That is usually when IBS is diagnosed. So how are SIBO and IBS addressed? What's the treatment? For SIBO in traditional medicine, they're typically going to recommend some sort of antibiotic along with a low FODMAP diet. Now the issue with that is that there's a very high recurrence rate of symptoms after treatment. Whereas in functional medicine, we're trying to figure out why someone has SIBO. So we're doing a lot of individualized testing and incorporating specific dietary plans to remove food triggers and encourage eating whole, organic, nutrient-dense foods while also correcting any imbalances within the microbiome by using herbs and natural supplements along with the dietary changes. We also support digestion if needed in terms of addressing low stomach acid, low digestive enzyme output, or poor gallbladder function or bile flow, along with making sure motility is optimal. There are also other factors to consider in some cases, such as toxicity and nutritional deficiencies. So what about IBS? How is IBS addressed? In traditional medicine, they're typically going to recommend things like antidiarrheals if we have IBS with diarrhea, laxatives if we have IBS with constipation, antispasmodic medications, cognitive behavioral therapy, etc. Whereas in functional medicine, we're trying to answer the question, why are the bowels irritated? We are again going to look specifically at the diet, remove dietary triggers and inflammatory foods, encourage eating whole, organic, nutrient-dense foods while balancing out the microbiome, optimizing motility, using good stress management strategies, along with supporting the adrenals through diet, lifestyle, and nutritional supplementation, since stress can be a trigger for some people with IBS symptoms. Again, there are also some other factors to consider in some cases, such as toxicity and nutritional deficiencies. So we've already talked about the definitions of SIBO and IBS, the symptoms associated with SIBO and IBS, the treatments associated with SIBO and IBS, and the testing associated with SIBO and IBS. So what are the big differences between the two? Well, we can first start off by the difference in the definition between SIBO and IBS. SIBO is the overgrowth of bacteria in the small intestine, where bacteria are usually low in number, whereas IBS is a functional GI disorder involving chronic abdominal symptoms without clear structural or biochemical abnormalities. There's certainly a lot of overlap when it comes to symptoms of SIBO and IBS. The most famous symptom for SIBO is bloating after eating in a majority of patients. In terms of the causes of SIBO and IBS, SIBO, remember, is caused by bacterial overgrowth, but often due to poor motility, adhesions from something like a past GI surgery, low stomach acid, history of antibiotic use, anatomical issues, etc. And IBS can be multifactorial, meaning it can come from food sensitivities, dysbiosis in the gut microbiome from overgrowth of yeast or candida, bacteria, parasites, and/or low beneficial bacteria, altered motility, brain-gut axis dysregulation, stress, post-infection changes, and more. So when should someone seek help? If you're having chronic gut issues, but you still don't know why, using the test, don't guess approach can be very valuable to try to figure out the root cause of your digestive issues. At Restorative Health Solutions, we offer a free 15-minute phone consultation to see if we're a good fit for you and vice versa. From there, we do an initial functional medicine consultation, thoroughly go through your history, and try to figure out what testing is best for you. At Restorative Health Solutions, we have several different test categories to consider when it comes to investigating the root cause of your gut health issues, such as food testing, like genetic testing for gluten sensitivity, food allergy testing, and food sensitivity testing. Testing for microbiome imbalances or infections by using stool and organic acid testing. Testing for toxicity by testing mold and mycotoxin testing, heavy metal testing, and environmental toxins testing. Testing for nutritional deficiencies by using an intracellular micronutrient test. Testing the body's stress response by looking at an adrenal or cortisol panel. Testing and ruling out any hormonal imbalances or deficiencies. Ruling out anemia, and also making sure that we don't have a blood sugar imbalance. Well, I hope you learned a little bit today about SIBO and IBS and the differences between the two. And until next time, I'm Dr. Paul.